Okay, we're good.
Okay. All right. Well, thanks for joining us today, Erin. To start off, I would just like to give kind of a bio for our listeners to know a little bit about your background. So you are a registered nurse. You were executive director of Minnesota Nurses Association from 2001 to 2007, which is the local labor union for nurses in Minnesota. You were elected to Minnesota House of Representatives in 2006 and became the DFL House Majority Leader in 2012. In 2018, you made a run for the DFL candidate for governor with healthcare as a top priority of that campaign. Did I miss anything? Does that sound?
That's me in a nutshell.
Awesome. Okay, so first, we're obviously here today to talk about a single-payer healthcare system. Can you tell us a little bit about what that kind of a system means to you and why you think it's important?
So, I, as a nurse and as a human, as a person, I want to make sure that people who need healthcare get it. And the elaborate financing system and the delivery system that falls from that we've created is serving its interests often ahead of the interests of the people who actually need care. And that really bothers me. It bothers me as an American, it bothers me as a mom, it bothers me as a nurse. And I think if we want to make sure that people who need care, and that's going to be all of us at some point, get the care that we need. When we need it, we need to take the system back for the people, take the system back for the providers, and put the providers and the people getting care back in the center of the care delivery system. And I think one of the most expedient ways to do that is to drive us to a single payer system that is going to focus more on not the myriad of financing systems, but instead how we're going to make sure that providers and the people in their care are getting what they need.
Okay, so really making the people the focus of healthcare again, kind of taking the insurance and the payment out of it.
It is remarkable to me when we think about a healthcare discussion now that so much of it is centered on bureaucracy and insurance companies and drug companies and networks and formularies, and not very much about people and the care that they need and their own experiences. And it, at the very core of healthcare is people who need care because they're sick.
Right.
And if we're not talking about them first and foremost, then I think we're missing the boat altogether. This is not a business venture that has as its product care. This is about care, and we've built a business model around it that is no longer serving the people, and we need to fix that, and we can.
Okay, great. So fixing the system, great. So you have an extensive background as a registered nurse and as part of the nurses union. How have those firsthand experiences shaped your views on healthcare?
So practicing nursing is such a gift and a reminder that life isn't easy for people, that when we need care, we need it. You can't cure your own cancer. Right. You need skilled professionals to do that. And I practiced in 2 different hospitals. I was a med-surg nurse, so I took care of people with chronic conditions in a rural community, and then was a surgical nurse there and here at the University of Minnesota. You see the very best of people in really challenging situations, and so often people rise to that occasion, but we've made it a lot harder, I think, for people to navigate a system that's super complex. And we're asking people to think of themselves as consumers when they're sick. And when you're sick, you're not going to think about which is the best oncologist to care for my pancreatic cancer.
Right.
You want to go someplace that you know can get the job done. My practice of nursing, and then the work with nurses all over the state, when I worked for M&A for so many years, has really informed my perspective. And I don't think about the healthcare system without thinking about the people in my care, those that I care for myself, or the nurses who share their stories to this day. And I have twin daughters, and one of them is a nurse now.
Oh, nice.
And so she is refreshing me all the time with examples of a delivery system breakdown that is hurting people.
Mm-hmm.
Yeah.
So you still have kind of feelers on the ground of what's
I have
happening.
a lot of feelers on the ground.
So then what prompted you to transition from practicing nursing towards becoming a legislator here in Minnesota?
It was a over the years transition. So I grew up in a family that loved politics, and they do. And when we're all together, and I come from a big family, we still talk about politics. And they taught me that it was something that was important. It was something that we had the right and the ability to use to build our future. So when I started practicing nursing and came to St. Paul, because I'd grown up in a small town in Wisconsin, I knew I wanted to find that intersection between healthcare and politics and policy making, and did that work for a long time with the nurses. But it was after I took care of my mom at the end of her life, and she had, a really lethal cancer. And she, like so many other people, was being denied some of the treatment she needed by the insurance company that I got mad enough to say, I know I can do something about that, and really came back from her funeral, and within just a few weeks had made a decision to run. And after a very competitive race, got myself elected because I believed that I could work with others to fix healthcare, and I still believe that this is going to take more of a push than I'd ever imagined when I ran in the first place, but that's okay. I'm up for that challenge, and I bet a lot of other people in Minnesota are as well.
Yeah, that's an incredible story. Wow. So in 2018, you did kind of take that push the whole way to running for governor. Healthcare reform is a huge part of that campaign. What did you learn about Minnesotans and healthcare during that campaign and making it kind of a statewide issue?
The reason why healthcare was such an issue in our campaign is because it's such a big issue for Minnesotans. And I have had the good fortune of spending most of my elected office talking with people all over the state of Minnesota. I really love people a lot, and I've learned, from my very first campaign that if you knock on someone's door or ask people how they're doing, more than likely they're going to tell you what they're thinking about, what they're worried about, and they've been my teachers, Minnesotans all over the state of Minnesota. So I know that people are struggling in all sorts of ways, whether it is because they live far away from a place to get reliable care, mental health care, for instance, delivering a baby has gotten harder in greater Minnesota, or the sheer cost of paying premiums all year long but still not being able to get to care because you can't pay your deductible. I mean, there are issues all over the state, depending on where you live, depending on what you do. And that made the issue of healthcare rise to the top of my agenda, but it was there because it was at the top of Minnesotans' agenda. I think that's still the case. And as a legislator, I know what the cost of healthcare is doing to our state's budget and the pinch that it's putting on our state's economy. So there are a lot of reasons why we need to address this. The beautiful thing that I learned in my many years of legislating is that if Minnesotans hear about the impact on people as a result of a system that's not working, Minnesotans most often respond with, we can do better. They show over and over again that we care about each other. And that blossomed in the course of our campaign. I saw it all over the state of Minnesota. But we have to remember to talk about each other and not talk about things in the abstract, but bring things back to the stories of ourselves, our family members, our neighbors. So we have that connectedness and we can see for ourselves, well, that really isn't working for this community or for this person. And the other thing that was really clear to me in the course of the campaign is Minnesotans are more ready than I think a lot of elected officials recognize for a significant and structural systems change in the way that we pay for and deliver health care. They understand with their own experiences, their own pocketbooks, they understand that the system is not working for us well anymore. And it creates a lot of insecurity for people. And sometimes that means we hang on to what we have. And I think we have to continue to show Minnesotans that we have the capacity, the innovation, and the ability to look at things that are already in place and expand them to work for more people.
Great, thank you. And I think that kind of naturally leads into my next question. You recently announced at a meeting with HCAM, Insulin for All, and other community members and stakeholders that you and Rose Roach, who is current executive director of MNA. You're announcing kind of a new effort for healthcare payment reform called Our Stories, Our Health, which sounds a lot like what you're talking about. Can you just kind of break down for us what this project is and what the goal is with it?
I think we have to change the narrative again in healthcare. As I mentioned earlier, we talk a lot about the cost of care. We talk a lot about the system, the bureaucracy, the insurance companies, the networks. But when we have made our greatest leaps in success in Minnesota and across the country, it is when we remember that what we're talking about is us. I like to call people's attention to the story of Alex Smith, and many people now in Minnesota know the story of Alex Smith, the 26-year-old who lost his life after rationing insulin. He had a good job, but he couldn't afford his health care. And he'd been a newly diagnosed diabetic just for a couple of years and went off his parents' insurance when he turned 26, and shortly after that lost his life. I met first Alex's dad, James, and then his mom subsequent to that. And they have, I think, shown us a really important and sometimes absent tool, and that is making sure that we're telling our stories. And I think because of the work of Nicole and James and others, but I think of Nicole in particular, the cost of insulin is an issue that lots of people in Minnesota are talking about. The cost of pharmaceutical drugs is an issue that people are talking about all across the country. The profits that the pharmaceutical industry is making at the expense of people is also something people are talking about all over the country. That's the power of a story. And I think we need, if we're going to pull us back away from a really polarized and divided debate around something that's as critical as people's health, I think we have to tell as many stories as we can, and they're all over the state of Minnesota, to make it impossible for policymakers to ignore the fact that the system is broken, so we can get on a path to actually making broad and systemic change. And that's the point of Our Stories, Our Health. And we are set to launch. We were out last week talking with a group of people, and I am so excited about this idea. And I know already, right, as soon as I start talking about it, people are like, I have a story. And so if people are listening to this and they have a story, they need to reach me, and can reach me at Erin@ourstoriesourhealth.org. And we will get in touch with you and make sure that we can share your story too. It is the thing that will bring Minnesotans back together around a solution that will actually solve the problem for us.
Okay. That sounds like an amazing approach. It sounds like you're really trying to get kind of that more personal empathy to kind of bring about change. And I think you're right, so many times I think we've had to intellectualize this debate a little bit to try to appeal to both sides, and I kind of think you're kind of coming up from the other side to appeal to both sides, and that's really powerful. So I'm excited to see what happens there, for sure.
Well, I hope you'll join us.
Okay. So kind of switching gears a little bit, the legislative session for 2019 has ended. What are you hoping that happens in the next legislative session in terms of healthcare reform? Anything you're looking out for or keeping eyes on?
Well, I was the first author of the very earliest version of the Alex Smith Emergency Insulin Act, and we introduced that, and I introduced it in 2018, and I had a hearing, an informational hearing. And of course the bill didn't progress, and it was in a very rudimentary form. Mike Howard is the author of that bill now. He represents James and Nicole in the legislature at their home in Richfield, and he's made just tremendous progress with that. And I can't imagine leaving that 2020 session without that put in place. And it's important that we put it in place, even though we see now some of the insurance companies yielding and saying, well, we will offer low cost or no cost insulin to our enrollees. That doesn't cover everybody in the state of Minnesota. And we know that insulin is like air. If you need it, you need it. And without it, you won't live.
Right.
So I think at the very least, we need an emergency stash, if you will, for people to get access to if they can't afford it on their own. But it has really revealed for us, I think, the larger problem of pharmaceutical costs. And insulin is not the only drug that is out of reach for people. So I will say that this last session for me was a disappointment when I think about how much Minnesotans are talking about the cost of care, their lack of security around it, their lack of access, and so little was done in response to that. I feel a deep frustration about that. So I would like to see much more done. And there probably aren't a lot of things. There's probably not going to be a lot of time to see the kind of significant change that I want to see. And so I think we're going to have to do more work in lifting up those stories and organizing behind that to make sure that the session that comes after this one in 2021 is a healthcare session. It's a session about the people of Minnesota and our health, where we can actually make some progress for people. And that's my aim, right? To create, if you will, the environment, the appetite on the part of people elected to represent us to actually take action on our behalf.
Yeah. Great, thank you. And you, again, perfectly led into my next question. So 2020 is a very important year, both nationally, but also here in Minnesota. State Senate is going to be up for re-election. So do you have any advice or thoughts for voters who plan to vote with healthcare in mind in 2020?
Yeah, I think that, first of all, I hope that voters who are listening to this share their stories with us, because that will help us come together around a solution. It is important to ask questions and pursue them, right? It is, I served in the legislature for 12 years, and especially at campaign time, when, we're moving pretty quickly, it is easy to ask a question and get a pretty simple answer that is an incomplete answer. So keep pushing, I say, to the voters. And especially when I think about the top of the ticket race in this next election, who we choose as our nominee, and their ambition about what's possible is important. And we see quite a range of really qualified candidates who have different perspectives on this question of healthcare. And I think that's important as well, to sort through that and engage early. So that we're selecting a nominee who's willing to go to bat for the people all over the country, because we need a strong nominee to win this next election, and we need a strong president who can build the future for the people of this country.
So engage early, push them. Vote for who will make a difference.
And vote, for crying out loud.
Just vote.
We all have to vote. Everybody has to vote.
Okay. Great. So that was actually all the questions I had for you today. Thank you so much again for your time, and we hope anyone listening will reach out to you to share their stories.
I hope they will too, and thank you very, very much for making time for me tonight.
Okay, great. Thank you.
You're welcome.
All right.
Okay.
Thank you so much.
Yeah.
Awesome.